This episode is brought to you in part by the Doctoring Differently digital course. Are you a physician looking for more freedom and flexibility in your career? Have you wondered how physicians of all specialties can explore lucrative autonomous career opportunities like locums, expert witness, medical writing, consulting, and even aesthetics? Or maybe you've wondered how physicians can get their own health benefits, retirement plans, and malpractice insurance. Redefine what it means to be a successful physician in today's changing world. Learn it all in this one-of-a-kind, 10-hour on-demand digital course. Visit doctoringdifferently.com for the full syllabus and upcoming enrollment information. Welcome to the Doctoring Differently podcast. I'm Dr. Naomi Lawrence-Reid, your host, a pediatrician, and creator of the Doctoring Differently digital course. I teach physicians how to explore satisfying, flexible, and lucrative careers beyond full-time clinical medicine. For more information, visit doctoringdifferently.com. Today, I'm joined by Dr. Shikha Jain, a GI oncologist and founder and chair of the Women in Medicine Summit and president of Women in Medicine, a 501c3 nonprofit organization dedicated to closing the inequitable gender gaps in healthcare. Dr. Jain is a tenured associate professor of medicine in the Division of Hematology and Oncology at the University of Illinois in Chicago. I'm so excited about Dr. Jain and all of the guests on the podcast who are creating their own paths in medicine. Subscribe to the podcast on Spotify, Apple Podcasts, or wherever you get your podcasts. And subscribe to the Doctoring Differently YouTube channel to watch all of the episodes on YouTube. And now for my conversation with Dr. Shikha Jain. Welcome to the podcast, Dr. Jain. Happy to have you here.
Thank you so much for inviting me. I'm so excited for this conversation.
Me too. Now, with most of my physician guests, I like to start in training with what made you select your specialty. I know you're a GI oncologist. However, we may get back to that for you, but I want to get right into, I think, the heart of our conversation, which is why and how you started the Women in Medicine organization.
That's a great question. So it all started when I was a new faculty member, and I started kind of reflecting on some of the things that had happened in my career. And I was getting a little bit more involved on social media, and I started seeing a trend where a lot of the challenges that I had faced, other women were sharing similar stories. And I was like, that's weird. I thought I was the problem. I thought that I had issues with figuring out maternity leave or barriers with leadership positions or those remarks that people sometimes make about you being a leader and a woman. I thought they were my fault. And the more I looked, the more I saw that this was actually a cultural systemic issue. And so I was like, I'm going to create a summit. So I was actually on faculty at another institution at the time. I created their Women in Medicine programming while I was there. And it was really successful because a lot of women felt the need to come together and not only talk about these problems, but really share solutions. So then fast forward, that was my first symposium I planned. And then after I left that institution, I said, I think there is a national need for this. So I launched the first Women in Medicine Summit. That was wildly successful. We had 450 people attend.
Wow.
It was really, beyond what I imagined it could be. And then the next year, the pandemic started. And when the pandemic happened, people were reaching out. They were saying, your summit was so great. We need something now. So I started creating leadership programming. I created webinars. I created a speakers bureau. I created a research lab. So throughout the first 2 years of the pandemic, we kind of started creating all of this stuff. We made the summit virtual. And then my father, who's actually a physician as well, said to me, there's a lot more here than just the summit. You need an organization. And so what we did at that point was I created the Women in Medicine 501c3 nonprofit, where all of our programming, our speakers bureau, our research lab, all of that kind of lived underneath that umbrella. And then the summit remained a freestanding event that we were able to create a really amazing community for. And that's how it all started. And now 6-7 years later, I'm looking back and thinking, wow, we've done so much in the last 7 years.
Yes.
And we've changed the lives of thousands of women at this point. And I'm just really proud at what we've been able to create with an immense amount of time and effort, but really support from countless volunteers
Sure.
who've made all of this possible.
That is absolutely incredible. Can you share a few of your success stories? Like, tell me about a woman or women physicians who've come to you and said, in this actionable, tangible way, the Women in Medicine organization, the summit, has transformed or changed my career.
I love that question because it gives me so much joy. It's funny because these emails and phone calls always happen to come on days where I'm feeling down or low or thinking, oh, this is too much work. I don't want to do this anymore. So I got a message on Twitter/X a couple years ago where this woman reached out and she was like, your summit legitimately changed my life. I came in, I wasn't sure about my career. I was trying to negotiate for a new position and I wasn't sure what I should be asking for. She said, I left your summit with an entire list of what I should ask for, how I should ask, and a network of women who I could practice my negotiation skills on.
Yes.
And she said, your summit actually led to me negotiating for a higher salary, a new position with more support and more resources.
Yes.
And I've never been happier in my career. And you changed my career trajectory. So that was one example. I had another example that happened very recently where a woman reached out and said, you don't know me, but I was embarrassed and shy to come talk to you at the summit. But I just want you to know that I was going through a situation where I was getting bullied at work. I was really miserable and I felt like there was no way out. I was considering leaving medicine altogether. She said, I attended your summit. I met other women who had been through similar situations. I used them for support. They are now some of my closest friends. And I used their advice and their guidance to help me find another job. And I've left my current practice. I'm with a new practice now, and I have never been happier in my career. And then I've had some people who've reached out and said, you know what? I realized there were other opportunities outside of clinical medicine. And some of them have said, I am now using the skills I learned to create side gigs and side opportunities. And some people who have left clinical medicine altogether and are incredibly happy in what they're doing, transforming healthcare outside of a clinical setting. So those are just a couple of the examples. And then the students that volunteer and the students who we mentor through the summit and through the nonprofit, many of them have become dear friends because they are just amazing human beings. And watching their careers grow and shine and hearing from them the way the organization and the summit have really helped them find confidence, help them be successful in their training. I mean, I've gotten these stories from everyone from trainees and students all the way up to people in the C-suite and at the dean level. It makes me happy because we also have this strategy of lift as you rise.
Sure.
So no matter where you are in your career, we try to help you and support you and sponsor you. So even some of the people who've attended who are at that dean level or at that chair level, they've actually reached out and said, finding your summit has really helped me become more successful in the position I'm already in.
Remarkable. So at this point in the podcast, you are my first physician guest who is still full-time clinical. So you are spearheading and organizing and founding Women in Medicine while still an associate professor, a GI oncologist. Did you get any pushback from your institution when starting Women in Medicine?
So I will tell you, I'm very fortunate. So I work at the University of Illinois Cancer Center, and I have gotten so much support from my institution for this initiative and beyond. My boss is amazing. So I will start with that, Dr. VK Gotti. I did not realize how important it was to have a good boss who is also an ally until I met him. He has been transformative for me just in my career and in the support he's provided. We have a CME cruise to the south of France in March, and he's actually one of our speakers. So if anyone wants to come to the south of France next year for a week with me and Dr. Kimberly Manning and Lieutenant General Mark Hertling, you can come there. But so going back to my job, I have been very fortunate because not only do they support what I'm doing externally, they've actually seen the value in what I've created. And they have appointed me to a task force internally, a Women in Medicine task force that I'm now leading to help us make transformative change within our own institution. And so I've created a subcommittee and we are working towards finding opportunities to provide the women in our own institution leadership opportunities, either internally or providing them leadership programming similar to the summit, similar to programs like ELAM and the Carol Emmett Fellowship, and finding resources and budgets to help support different events. This year, one of our summit speakers is actually going to be a University of Illinois visiting scholar and is also going to be speaking at UIC the day before the summit. So I have been very fortunate in that because they have such a huge support for what I am doing, they want to not only amplify what I'm doing external to the institution, but they want to leverage my skills and my expertise in this space to help transform our institution as well. And so I will say I started all of this programming prior to coming to UIC. I did
Okay.
my residency here, left for many years, and then was recruited back.
I see.
And one of the things I negotiated when I came back was this is very important to me. I love this work. I need to make sure that I have the time and the space to do that.
Mm-hmm.
And they were very accommodating. And so I've been able to incorporate it into my work within the institution. And then my free time is spent doing this stuff that I'm doing external to the institution.
And you have described what true support and allyship looks like, and that is money and putting more than words and more than maybe a little clinical buy down for some, but actual money behind an initiative. That tells me that they are serious and it's more than lip service, that they truly support you, they support the mission, and they see the value, they see the long-term benefits. And we can go into the benefits of supporting women in academics, in clinical medicine. There's so many statistics about the rates of women physicians leaving medicine. Could you speak to a little bit of the reasons why, women leave medicine, or the supports that are often elude them and make them feel unsupported so that they leave?
Absolutely. I can talk about that for hours.
I'll bet.
Before I get to that, I want to focus on one thing you said, which I think is really the key, which is why everyone should be supporting these women and why we need to keep women in healthcare.
Please.
And the data you briefly alluded to is we have countless amounts of data that show that when women are in leadership, when women are healthcare providers, when women are taking care of patients, patient outcomes are actually better. There was a study that came out showing surgical outcomes are actually better. There's less mortality, less morbidity. We have also seen there's less readmission rates when there are women physicians taking care of patients. And then when you look at women of color, there are even huger disparities in leadership and in the healthcare space. But we know when the leadership is representative of the communities that we are serving, the outcomes are better.
Mm-hmm.
So the first question is, why should we be doing this? Why we should be doing this is because it directly impacts the health of our communities. And we've seen that communities and institutions that retain women, they actually they get more awards, they have a better bottom line, they actually make more money. So it's good all around for everyone to keep women in medicine and keep women leading, and not only keeping them leading, but then elevating them to these positions of power. So to your question, why are women leaving? There are a myriad of reasons why women are leaving. So we actually published a paper talking about the implicit bias, imposter syndrome, burnout cycle. And we published this with Dr. Pauline Clance and Dr. Kelly Cockett. Dr. Clance is actually one of the two people who founded and created the imposter phenomenon scale and came up with the term imposter phenomenon, now often described as imposter syndrome. And what we found is there's a lot of biases that result in women not getting as many awards, not getting pay raises, not getting chosen for leadership opportunities. And that's driven by both implicit and explicit bias. It's not that these women are not qualified. It's that they aren't given the opportunities because of the systemic biases that exist. Then on top of that, these women are working harder and they're not getting the money. They're not getting compensated. There was a study by Dr. Aurora that showed women in medicine can actually have a $2 million deficit in their pay as compared to their male colleagues for doing equivalent work.
That's right.
So there's a pay gap there.
Yes.
All of these things lead to fueling imposter phenomenon, which then leads to fueling burnout. Women who go into medicine are often very brilliant. They're accomplished. They're ambitious.
Yes.
It's not that they don't want to be doing all this work. they often are doing the work, but then they're not getting the credit for the work they're doing.
Mm-hmm.
And before you even get to that, we already have this feeling of, I'm not good enough, I'm not smart enough, I'm not leadership material. And so when you compound that with then the external validation of, well, I thought I wasn't good enough and I didn't get this leadership position, or I didn't get this award, or I didn't get this pay bump. Now you're leading to this cycle of all fueling into burnout.
Mm-hmm.
And then when they burn out, they leave.
Yeah.
Then add on top of that, we saw during the pandemic, stereotypically, women are typically responsible for taking care of the home,
Mm-hmm.
responsible for childcare.
Mm-hmm.
The sandwich generation, often responsible for aging parents and also children.
Mm-hmm.
And I will tell you, as more and more men are stepping up, we are still seeing this huge divide where a
Mm-hmm.
lot of that burden falls on the women. And
Yes.
so that adds up. And I will tell you, unfortunately, because most of this data looks at gender as a binary and looks at couples that are male female couples,
Mm-hmm.
most of the data is there. But we see this in same sex couples. We see this for people of all genders when we describe this type of thing anecdotally.
Okay.
So, to answer your question, why women are leaving medicine, it's because things keep getting piled on and
Mm-hmm.
piled on and
Mm-hmm.
piled on.
Mm-hmm.
And when you're not getting those gains, when you're not getting the awards,
Yeah.
eventually it seems futile. People burn out and say, forget this. I could
Yeah.
be, making more money or spending more time with my family or having a better work-life balance if
Mm-hmm.
I wasn't doing this. Then add all of the abuse that happens
Yeah.
in the clinical setting. We saw it during COVID amplified rapidly,
Right.
whether it's online advocacy or whether it's in the clinic space itself. A lot of that abuse happens and people just said, forget it. I don't want to do this anymore.
Mm-hmm.
So again, none of this is saying that women are better than men or we should be talking about women doctors being better than male doctors. This is really about all of these external forces that then feed into this burnout. And then women say, forget it. Like,
Yeah.
I've had enough. And they leave. And then we lose some of our brightest and best minds.
I personally know a number of women physicians who I trained with in medical school and residency who were absolutely brilliant, let me not use the past tense, they are absolutely brilliant. But then by their early 30s, got married, had a few children, either married a man who was of a higher paying specialty or, a higher earner outside of medicine. But they then went part-time or eventually left and kind of pared down all of their clinical duties. And watching them from the outside is, for me, somewhat heartbreaking because I don't see a whole lot of, or what they've expressed to me is not a whole lot of happiness or satisfaction with that decision, that they made a decision that they're happy with to stay home with their families. It was more of, I can't do it all. I cannot be, leaving the house before my kids wake up and back after they go to bed, and guilty when I'm with them that I'm not doing notes, and guilty when I'm doing notes that I'm not with them. They have a very, very difficult time. And so watching them and seeing this pattern repeated and repeated, if there are any women physicians feeling that way right now, what would you say to them, where they are in their car listening to the podcast right now?
I will tell you, you are not alone. I just talked about this yesterday, where this past year especially has been a roller coaster for me, where I've had a lot of responsibilities. And my parents and my husband and I actually had a conversation. They said at some point, you have to figure out where your priorities are and where you want to allocate time, because you are heading towards crashing.
Mm.
You are going to burn out, and we can't have that. Like, you are doing too much good in the world. We can't have you burn out. And it's because I'm so passionate about so many things. And I also care very deeply about my family.
Mm-hmm.
And I also feel like I'm failing on some avenue, whether it's work or home, every day.
Mm-hmm.
And that is very common. And I want people to know that no matter how successful people look online, on social media, on TV, they are all struggling with similar things that you are. And a friend of mine actually gave me some really good advice recently, because I was in a week where I was drowning. I had all of these deadlines. I had all of this stuff. I couldn't get it done. My kids were crying. I yelled at them when I really don't yell at my children. And my daughter, who's 10, made me a plate of food and left it out and said, Mommy, you seem really stressed. I want you to take a few minutes and eat. And she's 10.
Wow.
And for me, that was kind of like a light bulb moment, like, wow, what am I doing here? And so I actually posted in a Facebook group and I said, what do you all do when you feel like you're drowning? And 150 people responded within a few minutes. And I felt relieved that I wasn't the only one. But Dr. Joanne Bisgrove actually wrote something that I think is something we should all think about. We are all juggling a lot of balls. Some of them are rubber and some of them are glass. Think about the glass balls first and prioritize them, because the rubber balls, you may drop them. You're probably going to drop them, but you can pick them back up. So that to me was really kind of a good analogy for how I should think about prioritizing things.
Sure.
The other thing, my mom gives me really good advice a couple of years ago where she said, honey, the more successful you become, the more people are going to demand your time. And it feels good to say yes to things. Ooh, you want me to speak here? Yes, I'd love to. How cool is that? Oh, you want me to be on this board? Yes, I would love to. She said, remember, every time you say yes to something, you have to say no to something else. And so think about, is this something that you would be willing to say no to something else for? Whether that's going to a kid's basketball game or whether that's accepting another position somewhere else. Because she said, once you're successful, people are going to keep asking and asking and asking, and they don't know all your other obligations, and they don't really care, to be honest.
No.
That's your responsibility to care. You need to take ownership of your life because you're the only one who knows how much you can do and where you should allocate time. And so I've started thinking about when I say yes to things. I used to say yes to everything because I feel guilty saying no. Now I've started looking and saying, okay, does this bring me joy? Is it good for my career? Is it financially beneficial? Is it something that I want to do because it's going to help someone else? And is it good for my family? And if it doesn't fall into one of those 5 categories, then I respectfully say, this is not something I can do. I'm going to suggest someone else for this opportunity. So then I get the opportunity to sponsor someone. And I did that recently for a really big opportunity that I still am questioning myself. Should I have said yes or no? But I sponsored someone else and she ended up with so many amazing opportunities from that one thing that I sponsored her for.
Great.
And I got to spend 3 days with my family taking a mental health break and enjoying the city of Chicago. And so in hindsight, could I have gone? Yes. Would it have been a huge burden on my family? Probably not. Am I happy I didn't go? So happy, because I got to spend 3 uninterrupted days with my family that I would not have had otherwise. So that's what I would say. Everyone's going through it.
Sure.
You have to learn to prioritize what is important and say no to things, and then figure out which ones of those things are the rubber balls that you can put off for a day or two.
Very well said. You said the G word, which I will say I don't hear too many men saying, and that is guilty. You felt guilty. And I can't tell you how many women, particularly mothers, I hear describing the feelings of guilt. I have heard mothers say they feel guilty that it rained. Of course, guilt implies culpability. So I don't think too many of us can control the weather or the rain, but I have heard mothers just feel such guilt over something even like the weather. And those feelings, I think that women just feel like we are responsible all the time for everything and making sure that things are perfect for the family, for the job, for the career, for our boss, for everyone, making sure that we haven't made anyone mad. We've done everything we're supposed to do. How would you advise a woman who is really struggling, particularly a woman physician, of course, who is struggling with those feelings of guilt, specifically guilt? And what are those things? What are some remedies for them where they are now?
I can tell you I feel guilt a lot. I talked to my husband about it and he's like, don't feel guilty. You're doing more than other people are doing.
See,
Like,
men don't feel it, or they don't say they feel it, but yes.
Exactly. And I will say, I think part of it is we put a lot of pressure on ourselves. One, there's societal pressures, right? There's all those memes out there where if a mom is on her phone at the playground, people are like, oh, what a horrible mom. And if a dad is at the playground on his phone, people are like, oh, what a great dad.
We're just glad he's here. Yeah.
Exactly. It's like the bar is set here and here based on your gender, which is not okay.
No.
But that is unfortunately the way society is still set up. I say, and I practice what I say, do what I say, not what I do. I feel guilty often. For example, my kids get home from camp. They were doing half-day camps this summer, and I want to take them to the pool. And so I blocked off time, and then meetings got scheduled during that time, and I was feeling guilty. My kids didn't know I was going to take them to the pool, but in my head, I'm like, oh, I'm taking away this specific summer activity from my children. I think that we have to realize we can't be everything at the same time to everyone. You can be anything you want to be, but you can't be everything all at once. And so one thing I've tried to do is I try very hard to protect my time with my family. So I tell people evening meetings, I try not to attend any evening meetings, especially if they're in person. And I tell them that's my family time. When I'm on call, obviously it's different. If I'm in the hospital, that's a different scenario. But if you're going to plan a meeting with me at 6 p.m., I'm so sorry. That's when I'm having dinner with my kids, or that's when I'm driving my daughter to soccer. So I can't do that. So I try really hard to assuage some of that guilt by having those time blocks. I also try really hard to be present with my family when I am there. They will say I'm not as present as I should be because I'm still on my phone periodically, looking at Twitter, Facebook, or whatever. But I try really hard to be present while I'm there. And I will also say guilt is going to happen.
Yeah.
Things are going to happen. My daughter had a spring fair 3 years ago and she got COVID. I still feel guilty about it. I didn't give her COVID. She got it externally, and then she had to miss her spring fair. But I still, 3 years later, feel bad that she missed her spring fair. We have to realize we can't control everything.
Right.
We have to deal with the cards we're dealt. But one thing we can do to try to modify and deal with that guilt is say, okay, I know from this time to this time, I am doing work. And I just tell my family, I am doing this. But when I'm with my kids, when I did finally get to take them to the pool, I was in the pool with them. My phone was away. I wasn't doing work stuff because when I'm there, I want to make sure they know that I am there with them. When I go to a movie with them, I'm in the movie with them. I'm not texting people. And I think that's really important way to deal with guilt. We're all going to get it. Realize you're going to feel guilty and then move forward.
Got it. Move forward. That is a great place to take a quick break. More with Dr. Shikha Jain when we're back. This episode is brought to you in part by Era Locums. Are you a physician seeking flexibility, autonomy, and a more fulfilling career? If so, Era Locums is the modern concierge locums company you've been looking for. They are hyper-focused on empowering exceptional specialist physicians to practice at the top of their licenses in healthcare systems that need them. Do what you love on the terms you love. Find your people today at eralocums.com. That's ERALOCUMS.com. This episode is brought to you in part by the Doctoring Differently digital course. Are you a physician looking for more freedom and flexibility in your career? Have you wondered how physicians of all specialties can explore lucrative autonomous career opportunities like locums, expert witness, medical writing, consulting, and even aesthetics? Or maybe you've wondered how physicians can get their own health benefits, retirement plans, and malpractice insurance. Redefine what it means to be a successful physician in today's changing world. Learn it all in this one-of-a-kind 10-hour on-demand digital course. Visit doctoringdifferently.com for the full syllabus and upcoming enrollment information. We're back with Dr. Shikha Jain, founder of Women in Medicine. And to continue our conversation, I wanted to ask specifically about boundaries and in a very specific context. This may not happen to you as much as you are a GI oncologist, but many women physicians are in primary care and pediatric facing roles. And a very constant thing that happens to us is friends and family texting us for medical advice. And I recognize that does happen across specialties, but I have found that so many of my primary care pediatrician and family medicine colleagues and friends, it's a constant barrage of questions, and they don't feel like they can ever say no. It goes back to our discussion about guilt, but they just don't ever have the space or capacity to say no. They put the kids down or take time, and they're really in there texting someone back and forth. I will say it even happens with physicians who are not pediatricians or primary care doctors texting us and asking us pediatrics questions. What would you say to such a physician in terms of boundaries? And I know that's a very specific context, but what would you say to a physician, a woman physician in that situation who's really feeling burned out from a lot of that interaction?
So I'll tell you, I've been there. I am there. I get those texts as well because
Sure.
I am internal medicine board certified as well.
I
So I'm
see.
triple board certified
Oh, wow.
in medicine, hematology, and oncology. So I get these across the board. Probably not as much as my primary care colleagues do, but I definitely get those. So this is what I suggest. I think of it in a kind of tiered way. I have some people, like my close family, friends, people who I'm very close to, who I feel comfortable having those conversations. I know
Sure.
they won't take advantage of me. They don't message me regularly. It's more for very specific things. Those people, I am all about it. And I tell them, I'm here for you, especially because I'm an oncologist. I get a lot of
Sure.
people, anytime someone's diagnosed with cancer,
Hmm.
I'm the first call.
Mm.
So there are some close family and friends that I have no problems helping with that.
Good.
Then there's a second tier where it's people who I'm kind of friends with who, might reach out and sometimes don't know boundaries, right? They don't know how to be respectful. And then they'll be texting me at 11 o'clock at night or 1 in the morning or, crazy hours. And so those people, I
Hmm.
will often say to them, I will say, you know what? I feel like this might be a good thing for you to talk to your doctor about. Do they have my chart? Because then, especially if you need a prescription or something, they can write it for you.
Mm.
They might be able to help you and guide you a little bit better. So that's something that I do sometimes, especially, I'm busy, right? I don't respond to texts right away. So if I'm in clinic, I don't respond to those texts until evening time. And I'll just say, sorry, I was in clinic. This might be a good thing for you to ask your primary care doctor or your pediatrician. Um, the third thing that I've done, especially when it's a friend of a friend or
Hmm.
somebody reaches out, for example, on social media, I get this all the
Oh,
time where
boy.
people will reach out on social media and they'll say, hey, I have this rash,
Oh,
or
no.
hey, I've been having chronic fatigue for X amount of years or what have you. And I'll often respond and I'll say, thank you so much for your message. I can't respond to medical questions online because of my medical license. I mean, it is a liability for a medical license,
Sure.
and our hospital actually doesn't approve of that, and my malpractice wouldn't cover it.
Mm.
So you can use that and tell people, I'm so sorry. I appreciate that you're struggling with this. Please reach out to your doctor because I can't provide medical advice in this way.
Hmm.
So I think it depends on who it is who's reaching out. But I think falling back on that as well, because it's true, especially if you don't know the person very well, or if it's a distant relative or a
Hmm.
distant friend, being able to say, my hospital is very specific that I'm not really allowed to give out this type of advice. Some people ask for prescriptions. I've had people reach out and ask me for controlled substance
Oh,
prescriptions.
wow.
And I will tell them, I'll say, I'm really sorry. I can't actually do that because one, insurance will give problems because you've never seen me before. I
Hmm.
don't have a documented visit for you. So there's ways to kind of to discuss it in a way that legally it's also a liability for you. So
Mm.
I think a lot of it depends on who the person is who's reaching out. I mean, I will tell you, I have friends who are pediatricians who every now and then I will text and say, hey, this is happening to my child. What dose should I give of this medication? So I've been someone who's done that as well, but I also know who I can go to
Yeah.
because it's again people who I feel comfortable asking, they also feel comfortable asking me. So I think when you set those boundaries, you need to be very clear
Right.
as to where do those people fall in those tiers and then respond
Right. And
appropriately.
be consistent every time. I think consistency
Yes.
is the key. Giving, a long-winded explanation and advice, and that, one time and then being curt or ignoring it the second time. I don't know. Consistency is key, but again, it's
Agreed.
another ball. It's another one of either the glass or rubber balls here going on. And we, of course, keeping the people who respect our time, our education, and our boundaries, they know where they stand, and we know where they stand in our lives.
Absolutely. And I think that is the most important point. You're absolutely right, is being consistent
Yeah.
because there are some people who I made the mistake of giving my time and energy early on,
Yeah.
and it completely drained me.
Hmm.
And it got to the point where I finally was like, I'm really sorry. I cannot engage in this anymore. I just don't have the
Right.
time. I have
Right.
3 children at home. I barely get any time with them. I have a full time job. I'm really sorry. So I think being consistent and then sticking with that is really important. I've learned the hard way myself as well.
Yeah.
And if you're the person reaching out and asking questions, make sure you are thinking, who is the person I'm asking? Be respectful of their time as
Absolutely.
well, and understand that if the positions were reversed, would you respond in the same way you want them to respond and act accordingly?
You really have to teach people how to treat you in all realms at all times. So, yes. I want to talk quickly about negotiation. We talked about that with at the beginning of the episode, talking about a lot of the support women in medicine gives to women physicians, particularly around negotiation. And I am very vocal, as you are as well, about our need to learn how to negotiate. And that is not a skill that is taught to us in medical school or in residency. I was specifically told at the end of residency, don't even try to negotiate your salary. I was told that by my assistant program director. Don't even try to negotiate your salary. It doesn't work for physicians. They'll get mad and start taking things away, so don't even try. And as a result, my starting salary was $125,000 in 2014 with almost $200,000 in educational debt. And I quickly realized that this was not tenable. What advice do you give to women physicians? I assume there's different avenues here, right? Academics or private, but what are some core tenets of negotiation for women who are looking to earn the money that they deserve?
So I will tell you, I got the exact same advice when I was going for my first job, and I also was wildly underpaid for my first job.
Mm-hmm.
But I think that the way I actually learned this is through the summit, because we have a session every year on negotiation.
Great.
And this year we actually have this woman coming who's going to talk about negotiate like an auctioneer. So
Ooh.
she's going to teach skills in how you can actually negotiate like an auctioneer. I'm going to attend that session. I'm very excited about it. But so some of the skills that I use, it's really hard. It's hard to ask for money. It's hard to ask for an assistant. It's hard to ask for an office. It's hard to ask for things because we have been taught, don't ask, just be happy with what you get. And so it was really hard for me. And it took me till my second or third job to really realize, how do you negotiate for what you want? So what I recommend is you go in with kind of this idea of what are the non-negotiables. Like, these are the things that if they don't fulfill X, Y, and Z, I'm walking. And you have to be prepared to walk.
That's right.
And then there's the next level, which are what are the things that I'm going to ask for, but it's okay if they only meet me halfway or if they don't give me these things. And then there's the things that are like pie in the sky. I want them to pay for my childcare. I want them to pay for 10 weeks of PTO, whatever it is, that you're like, I'm just going to throw that in there to see, because you never know what people are going to agree to. And so I go in with a very clear idea of what is non-negotiable, what is okay, maybe I'm okay with fudging or negotiating on, and then what are things that I would love to get but are bonuses, basically. I also talk to people ahead of time who have a similar position, and I ask them, what do you think I should be asking for? And I ask men and women.
Good.
Because I will tell you, the childcare thing, I found out that a male colleague of mine had asked for that in his negotiation. That's not something I would have ever even dreamed to ask for. So I think asking people of all genders ahead of time, what did you negotiate for? What should I keep? What should I say? Like, is not that big of a deal. And then also having an idea for salary.
Yeah.
I think that asking other people, you don't have to ask them, what do you make? You can ask them, what do you think would be a reasonable starting salary for this? And ask multiple people, get multiple ideas. You can also, there's MGMA data you can look up online. It costs money, I think, to access it, but some places have access to that. So see if you can get that data and go in with why you deserve to be getting what you need.
That's right.
The other thing I've learned in negotiation is telling people, if you want me to be, I want to exceed your expectations. If you want me to be successful in this role, these are the things that I need. I need an assistant. I need my own office. So I do a lot of TV, media, a lot of public facing type things. So one of the things I said when I started my job was, I cannot have a shared office, because if I have a shared office space, I will not be able to use it for these interviews. I will not be able to use it for these radio calls. I won't be able to use it in the way that can elevate our institution. So that's one way you need to think, why do I need these things? The second thing when you're negotiating is think about how what you're asking for is actually going to help them. It sounds counterintuitive, but it actually makes a lot of sense, because they care about their bottom line, right? They're going to be like, you don't need X, Y, and Z. So you have to show them not only why you need it to be successful, but how it's going to help the person you're negotiating with. For example, you could say, I need a private office because I would like to elevate our institution to a national leader in X. And I, by doing that, will also be able to get you opportunities to go on TV. Or I will be able to raise funding by reaching out to philanthropists. But in order to do that, I need these resources. And so having those ideas ahead of time and then telling them, this is how you giving me this resource is going to help you, it's more likely that the person you're negotiating with is going to advocate for you as well. So those are just some tips that I have.
Sure.
And then don't feel icky about it.
Yeah,
Don't feel icky about asking for money, because
Right.
we all feel icky about saying, I need a raise, I need a promotion, I need XYZ. Know that you deserve it.
Yes.
Be confident in that you deserve it, and
Yes.
go in with that attitude.
Yes.
And don't let them make you feel like you don't.
Yes, 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 and yes. And I'll say, for all of the times you said, it's hard to do, I'll add an asterisk. It's hard to do the first time you do it. Asking for money is hard to do the first time you do it. I will tell you, it gets easier. Advocating for yourself, internalizing that confidence, that feeling of I deserve it. I've worked hard. I'm smart. I have years of experience in education. I have excellent, patient care outcomes, and having that feeling that I will say, often academics, a lot of institutions and a lot of places dampen that and intentionally temper that in physicians, particularly physician women, to make us feel, as we started to talk about, like imposters, like we're never good enough. We'll never be good enough. We don't have enough research. We haven't taught long enough. We haven't seen enough patients or generated enough RVUs, and all of those metrics and things that I think very intentionally keep us feeling like we are on that hamster wheel and that we'll never quite be enough. So I will say, generating everything that you said, giving that swell of confidence that maybe in the beginning you're faking it, but after a while you're not. And every time you ask for money, I will say it was hard to do the first time I did roughly 6 or 7 years ago. At this point, I have no problem doing it, because it's a muscle like any other muscle, I think, in your body. It's the weight is heavy the first time. It's a lot lighter the second time. And anecdotally, I wanted to, having you on the podcast, I wanted to describe a situation that my medical school roommate told me about a few years ago. She is a neonatologist in the Northeast, and she, we talk a little bit about money, but she's cagey. We have those feelings. I understand. But she reached out to me knowing who I am, what I do. And she said, I want to tell you an interesting story that we had a meeting. Our department called in all of the faculty and said, everyone is getting a raise to $200,000. And then I was appalled to learn that she, as a neonatologist, was making less than that in a very high cost of living city, but that's besides the point. But the reason for that was because it was discovered that every man in the neonatology department was making more than every woman in the neonatology department. I don't know how it was discovered, but it was. This is one of those lack of salary transparency things, but for all of the reasons that you describe, that we've talked about, the reasons that women earn less. What would you have done in that situation? I'm curious.
In the situation of finding out that everybody was making less money?
All of the women were making less money, yes.
All of the women were making less money. I think if I was in that situation where I learned that, first, I would want to make sure the data was accurate, which you always got to check your sources.
Okay, sure.
And once the data is proven to be accurate, which I am 100% sure it was, once you figure out that that's accurate, you go to leadership and you say, this is a problem. How are we going to fix it? Because this is, one, very bad PR for the organization. Two, it's not ethical. And then three, after we have fixed the situation and make sure everyone is getting paid what they deserve, let's figure out how this happened and how to prevent it from happening in the future. Because I think, people aren't intentional in trying to pay people less. Well, let me rephrase. There are people who are intentionally paying people less. But I think that there is so much noise around this right now. We have brought this to the forefront. There is not only academic data, it's showing up in the New York Times, it's showing up in Time Magazine, it's showing up where now it is a part of the national dialogue. It's impossible to ignore now. So you approach it in three different ways. You talk to the person and who's in charge of all of this, and you say, number one, this is a PR disaster. We need to fix it right away. Let's make sure everyone is getting paid equitably. Number two, we need to be transparent in what we are paying people, because pay transparency is the key to making sure that people are getting paid what they should be getting paid. And then number three, let's do a deep dive. Let's figure out how this happened in the past and how it will never happen again. And then put out a statement acknowledging the fact that this was a problem and how are we going to move forward? Because that, at the end of the day, is what's most important, right? Rectifying the wrong and then making sure it's not going to happen again. And I know a lot of institutions, probably most institutions, have a pay gap. It's not a secret. The problem is getting that data is really hard. I'll tell you, I talked to someone from an institution. They called in an external consultant company to do exactly that, do a deep dive and figure out, is there a pay gap? After they did all of the information, collected everything, the data wasn't available to anyone other than the top leadership. So while all that data was collected, nobody knows what the data actually showed. And the people who actually asked for this audit never got feedback as to what it showed. So that is not the right way to deal with something like this. The right way to deal with it is to address the problem, fix the problem, and then put out a statement saying, this was the problem, we have fixed it, this is how we're going to make sure this does not happen again in the future. And I can guarantee every institution out there, if they did an audit like that, they would see disparities.
They absolutely would. And they would pay those consultancies probably six figures to do the audit. That's generally how those systems work. And I can't discount, I just cannot discount how salary transparency it's an active obstacle for us. The AAMC charges physicians $1,500 for 1 year of salary data. So you have MGMA, which you mentioned, but the AAMC, again, $1,500. That sounds very much like an obstacle, and a very intentional obstacle to physicians to having that data. So if you're a physician listening and thinking, how do I know? How do I know if I don't ask each physician what they make, which is, of course, a little gauche, then I agree. I just want you to know that these obstacles are intentionally put up in place. But as you've mentioned, that we do have ways of circumventing them, asking them, networking, talking to other physicians about it, because that part really is not our fault. And finally, as we started but with saying, our labor really is our leverage. When I find out, which has happened, when I do get a bit of information that, a male colleague is making a lot more, or let's be honest, a lot of times we're finding out that nurses, because they're unionized, because they come as a collective, oftentimes in the primary care world, nurses and doctors are making the same. And I have seen that multiple times, yet physicians don't leave. They don't leave. That is what I've seen time and time again. We stay, we grumble about it, but we keep going, which tells me and tells the organization, well, we must be fine with that. That's what we're earning what we deserve if we continue to work for that, which economically makes perfect sense for them. Why would they pay us more if we'll work for less? So at the end of the day, for all of the negotiation tactics that you mentioned, which we should all have and use and dispense, at the end of the day, I agree, you got to be willing to walk, and your labor is truly that bedrock of leverage that we'll have. Tell me, so the Women in Medicine Conference is coming up in just a few months. Please tell me and tell our listeners why they should attend.
So everyone should come to the Women in Medicine Summit. And I say this not just subjectively because I run it, but also objectively from what people have given me feedback on. So it's September 13th and 14th in Chicago, Illinois, and you can register at womeninmedicinesummit.org. It is a transformative conference. It's CME, which is great because we all need CME. Yes. But more than that, it is fun. So we do it at the Drake Hotel because I am sick of going to conferences that are in hotels with conference food and they're not very fun. We have so much fun at this conference. The food is fantastic. I got married at the Drake, so they know me and they know the food I like. So the food options are phenomenal. Yes. The breaks, we have a candy bar. Last year we had a boba tea bar. So we try to be really creative in the food. So the food is one part. You can tell I'm a foodie. I'm from Chicago. Number two, the networks you create there are transformative. When I say transformative, I mean it in every sense of the word. In your personal life, in your professional life, You can find people who are going through the same thing as you. You can find people who are going through something totally different than you, and you can get advice from all of these people. I have people who have come every single year because they've made friends at this summit that they now use it as a meetup every year. So that is another reason. You just meet incredible people. The third, the content is so great. When I say it's great, I wish there was another word I could use to describe the content. I mean, we have people like Dr. Jessie Gold. Her book will be available there, which it's not even on sale like in stores yet. We will have her book. She'll be signing it. Dr. Kimberly Manning is just a force. Dr. Jen Gunter, I mean, if you don't know her, I invited her just because I want to meet her because she is one of the coolest people I've seen online. Dr. Julie Silver, we have speakers that are people that I invite because I'm like, I just want to be in a room with these incredible people. And then the talks they give, I mean, you get goosebumps just listening to these people, and you leave with real skills. So, skills that you can use to help you in your personal and professional life. If you're feeling burned out or if you're loving your job, these are great ways to learn how to get even more out of your career, out of your personal life. And it's such an inspiring couple of days. And this year we're having a gala on Friday night. So if you like to
Wow.
get dressed up and party, we're having that on Friday evening as well. It's just, I can't describe enough what an incredible 2 days it is.
Okay.
And you can talk to anyone who's been there before. If you want to email me, I can connect you with people who've attended before. Every single person leaves there feeling like they've changed, whether it's in their personal life, their professional life, or just with a whole new group of people that they can connect with and use for help, whether it's negotiating for a new job, moving across country, or just people to talk to when your child's having a meltdown because you cut the peanut butter sandwich wrong.
Mm-hmm.
Like, there's just an incredible group of people there. And I highly recommend you register. If this is your first year, take that leap. It's CME. Your hospital should be able to cover it with their CME costs.
Mm-hmm.
It's really a worthwhile expense to invest in yourself.
And give us the website one more time.
womeninmedicinesummit.org.
Great, great. And quickly, do men have a role in women in medicine?
They absolutely do. I mean, we can't make these changes, whether in our own life or systemic changes, without men not only at the table, but leading the charge. We actually have a panel this year with Lieutenant General Mark Hertling, Dr. Mark Shapiro, Dr. Sanjay Juneja, Dr. Garth Walker, that is specifically on how can we get more men to be innovative allies.
Mm-hmm.
Many of my sponsors and mentors have been fantastic men,
Mm-hmm.
my dad being one of them. I think that there is a huge need for men to be in this space and learning about the challenges. So we have a lot of men who come every year. My husband comes every year. And before I started all of this, he didn't understand the challenges that I was facing. I will tell you now, he's like, your conference, men and women, everyone should attend it because one, it's a great leadership conference. So you learn leadership skills regardless of your gender.
Mm-hmm.
But two, it also helps really dive into some of the problems that women are facing. And if you're married to a physician, if you are a physician yourself, this conference is really for you as well. And so we invite men to attend just as much as we invite women to attend.
Oh, great. So it's for men and women physicians. Okay, so
It's people of all genders are welcome to
people
join.
of all thank you. I don't want to be binary. People of all genders. If you have a body, you can attend the Women in Medicine Summit in Chicago, Drake Hotel, September 13th, 14th.
Yep, exactly.
Perfect. As we close, what is your end goal? What is your ultimate mission? You know, you seem like a woman, you seem like someone like me who, you know, while I'm doing the work here right now, I'm also 5 and 10 and 20 years down the road as well in terms of building my organization, building my networks, and making real change in medicine and in the world. What is your long-term goal for women in medicine?
I want to drive positive change. That's what I want to do. I told my kids, because they asked me, why do you do all this? My family, they asked, why do you spend so much time doing these things? Because I'm not getting paid. I'm not making millions of dollars. I'm doing it in my free time.
Mm-hmm.
And I tell them, you know, one of my dreams is to leave the world a little bit better than it was when I came into it. I want to leave it better for the next generation. And our healthcare system is so broken
Mm-hmm.
right now. Gender equity isn't the only issue. I advocate on a lot of topics, but for me, women in medicine, the Women in Medicine Summit it has the real opportunity to not only drive change by changing the systems, but also has the ability to drive change by helping these women get into those positions where they can drive change as well. The ripple effect of what we are doing in September at the summit and then year round throughout the nonprofit has already started to be felt in different institutions. My institution is a public hospital. I never imagined we would see a women in medicine task force there, and look at what we've been able to accomplish. So I think that there is so much we can do with our collective voice. And our hashtag is WIM Stronger Together, because I really feel by creating these networks, by creating these spaces, by creating these conferences, we are really able to drive change at a national and potentially even global level.
Yes.
And then if I can help even a few women find passion and drive and joy in their careers again, and help them find that ability to balance their professional and personal life, that makes me very happy. So that's what I'm looking for, driving change in whatever way I can.
And I know you will. That is undoubtable. So I'm going to close with my final question that I ask to all physicians, and that is, did this version of your career happen on its own? Did it fall into your lap, or did you have to take some action in order to make it happen?
I always tell people, if you told me 10 years ago I'd be doing what I'm doing now, I would have laughed, because this is not the space I saw myself in. It intentionally happen, but it also unintentionally happened. I think that I saw a problem and I decided I was going to do something about it. And then I had to work really hard to get to where we are today. So to answer your question, I think it's both. I think some of it happened because I just decided I was going to do it. And I said, I'm going to do this and we'll see what happens. But since that moment, it's been very intentional. I've done a lot of hard work to get to where I am today. I've also been very fortunate with the people who I've come across and who've helped me get to this point. I would be nowhere without them. So it has been intentional. It's been a lot of hard work, but I think it's been worth it.
From where I'm sitting, it looks like it has. So thank you so much, Dr. Shikha Jain, for coming on the podcast. I can't wait to see what you and women in medicine do in the future.
Thanks so much for having me.